You got your MRI report. It says disc bulge at L4-5, and you still have no idea why you hurt so much. Your doctor reviewed the reports quickly, gave no real explanation, and you were left with pain and confusion. In this video, you'll finally understand what a lumbar disc bulge actually is, why it creates sharp leg pain and disabling lower back pain, and what it means for your recovery. Then I'll show you the same non-surgical, safe treatment that I've used with thousands of patients to get fast relief and long-lasting results. If you want real answers for your disc injury and a clear path to permanent recovery, keep watching. Stay until the end because missing any part of this video could be the reason your disc problem never fully heals. Hi, I'm Dr. Kevin Wafer, a chiropractor in Houston, Texas. I help people get relief from disc bulges, sciatica, pinched nerves, and chronic spinal issues without surgery or medication using chiropractic corrective care. Subscribe now if you want simple exercises and proven tips to help you feel better, move better, and stay pain-free. You saw L4-5 or L5 disc bulge on your MRI report and probably felt a mix of pain and confusion. That reaction is normal. Most people are handed a sheet of paper with a scary sounding diagnosis, but no one fully explains what any of it means. So let me make it simple. A disc bulge is not your spine falling apart. It's your body telling you that the disc is shifted or swollen just enough to irritate the nearby structures. That irritation can send signals into your back, hip, or all the way down your leg. The MRI report uses clinical terms, but your pain feels personal. That's why you deserve a clear picture. Imagine the disc as a cushion between the spinal bones. When it gets stressed or damaged, it can push outward and crowd the space where the spinal nerves live. That alone can create leg pain that feels sharp, burning, or electric. And the confusing part is this. MRI report or images might look dramatic, but the pain you feel often comes from inflammation at the disc and around the nerve, not the size of the bulge itself. This is why two people with the exact same MRI findings can feel completely different levels of pain. What matters right now is not the scary wording on the report. What matters is understanding the exact mechanism behind your back and leg pain. Once you understand that, everything becomes less overwhelming and a lot more fixable. Now that you know what your MRI is actually telling you, let us go one layer deeper and explain why this disc bulge hurts so much in the first place. Here's what your doctor probably never explained. A disc is built like a tough tire on the outside with jelly-like center in the inside. The outer layer is a strong fibrocartilage, and its job is to contain the inner gel and keep your spine stable. But when the outer layer gets overloaded or stressed, tiny tears begin to form. These are called annular tears. And once those tears are formed, the disc becomes weaker and the inner gel starts to push outward. That outward pressure is what forms a disc bulge. Now here's the part most people don't realize. Many disc bulges never cause pain. They show up on an MRI and never bother the person. You can live your whole life with a disc bulge and never know it. The real trouble starts when the disc becomes inflamed or when the bulge begins to crowd the nerve as it exits the spine. When inflammation builds around the disc, it triggers localized lower back pain, the muscles tighten, the area becomes tender to the touch. Even simple bending forward increases the pressure inside the disc and sends sharper pain through your lower back. That inflammation can spread into the small tunnel where the nerve root sits. If that space swells, the nerve becomes irritated, which not only increases pain, but also slows down the healing process. And if the disc presses directly on that nerve, things escalate fast. That's when you feel shooting pain down your leg, or that burning line in your calf, or numbness in your foot. If the compression becomes chronic, the nerve can weaken and you can develop symptoms like foot drop or muscle loss in your leg. All of this sounds intense, but the key is understanding what is actually causing your pain. Once you know that, the path to relief becomes much clearer. So now that you understand the mechanisms of your pain, let us break down the real causes your doctor probably never talked about. Most people think disc injuries only happen from trauma, a fall, a sports injury, a car accident. And yes, those things can damage a disc. But here's the truth. The majority of disc injuries I see in my clinic are not caused by a big accident. They build slowly, silently, over years. The most common cause is bad posture and spinal misalignments. When your posture moves you away from its natural position, the load on the disc changes. Your body weight no longer sits evenly across the disc. Instead, it shifts forward or backward or to one side. And that uneven pressure stresses the annular fibers. Over time, those fibers weaken, tiny tears form, and that sets the stage for a disc bulge to develop. Spinal misalignments work in the same way. A small shift in the lower spine might not hurt at first, but it changes how your body carries weight. Day after day, the disc absorbs abnormal forces, and eventually that outer layer gives way. That's why most disc bulges are not sudden injuries. They're the final result of long-term stress on a disc that's been struggling for years. Then one day you do something simple. You get out of bed, you bend over to brush your teeth, you pick up a bag, or sometimes you do nothing at all, and your back locks up, or your leg lights on fire. It feels sudden, but the truth is the disc was already compromised. That final movement was just the last straw. Understanding this is important. It means your pain did not come out of nowhere. There's a clear reason behind it. And now that we know what caused the injury, we can focus on what actually heals it. So let's move into the next part that matters most, what truly fixes a disc bulge without surgery. Here's the problem with the typical medical approach. You walk in with L4-5 or L5-S1 pain, and you're given painkillers or anti-inflammatories. They may take the edge off, but they don't fix the underlying problem. They do not correct the postural distortion or the spinal misalignment that caused the disc to weaken in the first place. And when those medications stop working, you're sent to a specialist. Maybe they try a cortisone injection, an epidural, or a nerve block. Some people say they help, others say they did nothing, but none of them correct the cause of the disc bulge. And when all of that fails, surgery is recommended. Even if surgery reduces the pain, you still have to recover from the actual surgery. And research shows that recurrent lower back pain can return in 15 to 25% of patients within 2 years of back surgery. So what is the non-surgical solution? In my clinic, I use a 3-phase approach that relieves the pain, stabilizes the spine, improves alignment, and directly decompresses the discs without surgery. Phase 1 is all about calming the irritation. We use electric muscle stimulation to relax tight muscles and reduce nerve irritation. We use ice to lower inflammation around the disc and calm the local swelling. And we use chiropractic adjustments to correct the misalignments above and below the injured disc level. When those segments start moving the way they should, the irritation on the disc decreases and it finally has a chance to heal. Phase 2 begins once the pain settles. This is where non-surgical spinal decompression comes in. The decompression table gently stretches and relaxes the spine in a controlled rhythm. It creates negative pressure inside the disc, and that pressure helps draw the disc bulge back towards the center and reduces the stress on the nerve root. It's comfortable, targeted, and the success rates are strong when patients follow protocol. Phase 3 focuses on holding the correction. When the pain is about 50% better and the spine is moving correctly, we add stabilization exercises, bird dogs, glute bridges, planks, mobilization exercises like seated pelvic tilts and cat-camel. These movements strengthen the core, support the spine, and protect the healing disc so symptoms don't come back. This is why a multimodal approach works so well. We're not throwing medication at the problem. We're correcting the cause and healing the tissue and rebuilding the support system. And it all starts with a thorough examination, a detailed exam, and proper X-ray analysis to map out exactly what your spine needs. Now that you know the process that actually works, let's talk about the results you can expect and how to know that you're truly healing. When you understand your MRI, when you finally know why the pain shoots down your leg, and when you learn what actually caused the disc to weaken and what it takes to reverse it, the fear suddenly drops, the confusion fades, and you begin to realize that your body isn't broken. It's just reacting to something you can change. You now have a clear path forward. No guessing, no Googling symptoms for hours, no bouncing from doctor to doctor hoping someone gives you a real answer. You know exactly what is happening in your lumbar spine. And more important, you know how to fix it. As the inflammation settles, the nerve irritation calms down. The sharp pain in your leg starts to fade. Your back stops locking up. You can bend, you can sit, you can walk without bracing for that next spike of pain. And when your spine is aligned and the disc is decompressed and supported, something powerful happens. Your confidence comes back. You feel safe moving again. You feel like yourself again. This is the point where patients tell me they wish they had understood all of this years earlier, because the path to healing was never complicated. It was just never explained. My recommendation to you is to find a chiropractor who specializes in spinal decompression and uses a multimodal treatment approach, like the one I show in this video. If you need help finding one, drop a comment, let me know, and I'll do my best to point you in the right direction. If you got clarity from this video and you found value in it, like it and share it so more people can finally understand their pain and get real answers. If you have any questions about disc bulge treatment and recovery, drop them in the comments below. I read and reply to everyone. And remember to subscribe if you want simple exercises and proven tips that help you feel better, move better, and stay pain-free. Now, the next video you should watch is this one. It covers 5 gentle exercises you can do at home to relieve pain from a lumbar disc bulge. Go watch this video next.